Thank you, Dr. Roberts. My name is Kelsey DeClue. I am the Public Relations Coordinator for the COVID-19 Community Task Force, as well as Columbus Regional Health. So just so you know, the format today will start with updates from Dr. Brian Ebalski, Dr. Tom Sonderman, Dr. Jim Roberts, and the Mayor will also have a few remarks. We will take questions at the end, but if we can just wait until the end for those, Dr. Roberts will let you know, and we'll also be taking them from those virtually tuning in. So thanks everyone for being here, and we'll get started with Dr. Ebalski.
Thank you, Kelsey. As Dr. Ebalski is coming to the podium, I want to do an online check. Barney, Julie Harrison, are you able to hear us okay? Barney, if you give me a thumbs up because I can see you. Are you able to hear us okay? Very good, thank you. All right, Dr. Ebalski.
Okay, thanks, Dr. Roberts. Dr. Brian Ebalski, Bartholomew County Health Officer. I just wanted to give some brief updates on the status of COVID-19 here within our community. So for the last few weeks, we've been seeing record numbers of COVID-19 across the state, and now we're starting to see deaths on the rise as well. Now, we're seeing those numbers starting to increase at our local community level here over the last several days. We are seeing the per capita positive rate and percent positive rate for COVID-19 at their highest levels since April. Our local hospital is also starting to see the effects of this increased activity. I'm going to talk later about some of the local mandates that we'll be putting in place, but for now I want to introduce Dr. Tom Sonderman and let him discuss the situation within our local hospital system.
Thank you, Brian. It's my pleasure to be here. Our Chief Executive Officer, Jim Bickle, was unable to be here today, but he sends us to convey the message that CRH, supports the efforts and the decisions that will be made and that we will discuss today regarding all the organizations that are present here today. So, I also want to thank all the members of our community for all their wonderful dedication to getting us this far in the pandemic. It's only through the help of everyone that we have succeeded the way we have. So currently the situation at Columbus Regional Health is that we're experiencing a very high inpatient census. This increase in hospitalizations is both COVID and non-COVID related patients. Currently, CRH's biggest challenge is staff being affected by COVID. Either the staff being COVID positive or them being a close contact of a COVID positive individual and therefore being quarantined and taken out of the workforce. Contact tracing has revealed that the contracting of COVID from the member of the person's household or social gatherings, be it a Halloween celebration or a birthday party or wedding and the like, is serving as a source of a major factor in our increased transmissions. All of the major indicators that we track, that Dr. Ebalski made mention of, are moving in the wrong direction, indicating a significant community transmission of the virus. CRH is experiencing this consistent with the state of Indiana, where our hospitalizations as a whole are increasing, both from COVID and non-COVID patients. The use of intensive care resources is increasing across the state, and Columbus Regional Health is experiencing the same thing as well. And regrettably, the number of COVID deaths in the state of Indiana are starting to rise as well. So, from Columbus Regional Health's perspective, what we're currently doing or not doing, in the community, is not currently working for us as far as controlling the spread of the virus, and we feel that we must redouble our efforts, to start to follow those appropriate measures to limit the spread of the virus. The message can sometimes seem maybe a little bit tired and old, but those same things that brought us to success, heretofore, we still need to do. The masking, committing to hand washing, social distancing, and avoiding large gatherings are still the major tools in our toolbox to help us control the virus until there is a more widespread, effective vaccine available for the population at large, or therapies that can be directed towards COVID, the COVID virus, that would be more widely available to the population, both of which a proven vaccine or therapies that are directed towards COVID COVID. Neither of those are currently available to the population at large, and that's what will be needed for us to effectively control the virus in a long-term fashion. And so those techniques that we described before, masking, hand washing, social distancing, and avoiding large gatherings, are the major tools in our toolbox to buy us time, hopefully flatten the curve and reduce the surge of cases while awaiting these more definitive therapies to arrive on the scene. So thank you all very much.
Thank you, Dr. Dabalski and Dr. Sonneman, for kind of setting the stage for us and helping explain what is going on right now within the community with the spread of COVID-19. I think our community recognizes how challenging it was to even begin this school year with in-person learning, that we worked really hard to get to the point where we could provide both in-person and remote options to our families to be able to start school on August the 10th and try to roll through it. And with each week that we were able to accomplish that model, that situation, we were very satisfied. And when we got to fall break, 8 weeks in, if we take the week that we had of getting our teachers ready, and we delayed the start just by a little bit, got to August 10th on a Monday to start, and we consider that first week of teachers and then 8 weeks of instruction. We had 9 weeks of kind of together of keeping things rolling in the right direction. On Friday, October the 2nd, as we got into fall break, we had 29 identified positive cases within our school corporation of students, support staff members, and teachers. So 8 weeks plus a 9th week of having staff here. Since fall break, roll into fall break, and then now 4 weeks after, so 5 weeks since that Friday, October the 2nd, we have picked up an additional 71 test cases, positive test cases. So we have went from 29 to an even 100 right now in terms of what is going on within our school corporation. That 100 includes 68 students, 21 support staff members, and then 11 teachers. Now do recognize that 100 is out of about 13,500 people. We have about 11,500 students and about 2,000 staff members, but 100 positive test cases, and then the complexities that go with the close contacts that occur because of those positive test cases. So we start school August the 10th, we get to hear those are our numbers. And again, we have felt really good about having gotten here through the fidelity of many mitigation strategies, whether it be monitoring temperatures as our kids and staff came into the buildings, wearing our face coverings with fidelity, practicing hand hygiene, and physically distancing. All of those strategies that we've deployed since that time, and we believe overall have worked. Because if we look at the cases within our school, even that number that I've provided, we don't have evidence that a case is resulting in spread within the schools. So we believe that those mitigation strategies have worked. And because of that, I do need to thank all of our teachers, our support staff members, and administrators who have worked so hard to get us through now 60 days of continuous instruction with this in-person and remote option. We also appreciate the community support of our efforts because we know the community wants us to have an in-person option. And we appreciate their work in helping us by also practicing and these sound mitigation strategies out in the community. But we need to have that effort and that help continued. As Dr. Dabalski and Dr. Sonneman indicated, our numbers do not look good right now in the community. I've given the data from the school perspective. But if we look at our local indicators, the per capita rate that was published yesterday on the community's COVID-19 task force indicated that we were 33.4. That's a red with our local indicators that we set way back on July 20th when we put forth a plan to reopen school. Here are these indicators we're going to look at. That's a red, 33.4, and the highest number since back in the spring. Hospitalizations, we're at 17. I think the number today might be 15, or yesterday that was reported. Still a red number if we look at the way we measure that as per our indicators. And the positive test rate, at the last published number, it was 13.2%. That does lag by about 4 days on us all of the time. So a lagging indicator, it is heading toward 15, which by our measurements is also a red. So we could be this weekend, as we look at all those numbers, 3 reds in terms of the indicators we develop locally. If we look at the state level, through the Indiana State Department of Health, their color designation for our county is yellow. The counties around us, for the most part, brown is blue, blue, yellow, orange, red is the order, blue the best, red the worst, we're yellow. But if that data is lagging as well, and so since that data is based upon Sunday to be published Wednesday, in our daily look at our local indicators, and if we then convert that to what the state would tell us next week, we anticipate orange for Bartholomew County. So we're looking at 3 reds on our local indicators, likely an orange when the State Department of Health releases their information next week, and then really no sign that those numbers are going to go down. Something that we shared at our last school board meeting was that if we look at the Friday that went into July 4th weekend, and we go out 5 weeks from that, actually about 37 days, we saw a spike in the number of cases within our community. That's when we went red at the beginning of the school year. And we were worried at the beginning of the school year whether we were going to be able to continue our in-person instruction because the per capita number was increasing. We settled back down, and then we got to Labor Day weekend. And the Friday going into Labor Day weekend, 5 weeks later, about 37 days again, we saw a spike, that same number getting us back into the red from a per capita standpoint. And if we look at, since the Friday for beginning fall break at October 2nd, I indicated we've had 71 cases since then, 36, 37 days hits right now. So the cases that we've had since then are not necessarily indicative of anything occurring over fall break. Those numbers might impact us again here now, and we'll see what happens as we go forth. So we're seeing those numbers around us. And as we as a school corporation looked at all the options perhaps available to us, staying in person with that remote option, going to a hybrid model, because everybody's aware, I think now, that we approved a hybrid model to be an intermediate step between where we are in person with a remote option to having to go all e-learning. And we looked at the hybrid model, the problem we saw was we need the same number of staff members in our buildings to support that model. And that becomes our major problem. And Dr. Sonderman indicated the challenges happening at the hospital from a staffing standpoint. We have that problem. Yesterday we were 23 bus drivers short of covering our routes. That's about a fourth of our routes that we were trying to get through Bartholomew County to serve our schools. We had 21 classrooms without the proper staff in them, and that's even after taking the internal resources we had and putting them toward those classrooms. Today, I've not seen the most recent information. Heading into today, we were 29 classrooms. Those kinds of things make it extremely difficult to continue the operations and provide the needed instruction we can for our families, our community. So it is with a great amount of disdain, consternation, that we get to the point where we have to pull the trigger, flip the switch, go to something else besides this in-person remote option, and make a final decision to go to all e-learning. But as is the case, or was announced yesterday, to try to give our community, our family members, as much opportunity as possible to make proper decisions heading into the next few weeks, BCSC will be going to all e-learning beginning Monday. And we will be on all e-learning through at least the week of Thanksgiving. I say that because we will continue to monitor what's happening within the community to see if we are able to return after Thanksgiving and get back to e-learning on Monday, November the 30th. And in order to do that, we have to have improvements in those numbers within the community. So I am simply asking, as we talk about all the mitigation strategies that are in place in our schools, and that we are not perfect at all. And oftentimes somebody will let me know that somebody's not wearing a face covering, or not practicing proper physical distancing, or they didn't wash their hands often enough, or maybe a person was missed getting a temperature checked, or the temperatures are wrong. Whatever the case might be, every day we are trying really hard to do those things. We need the community to try really hard to practice with as much fidelity as possible those exact same mitigation strategies. Wear face coverings, wash your hands as often as you possibly can, maintain physical distancing, and then attempt to avoid large gatherings that seem to be great sources of additional spread. Anecdotally, if we look at our positive cases, which again, no evidence that we are increasing spread within our school, if we look at our positive cases, many of those coming from events outside of the school that have been pretty large gatherings, and I cited already the July 4th, Labor Day weekend, and now what might come out of fall break. As we move forward with this situation, again, all e-learning beginning Monday, 3 weeks that includes Thanksgiving, try to come back on Monday, November 30th. We will watch the data, continue our conversations with our local medical professional and the community's COVID-19 task force to see where we might be. Over the next few hours today, into the weekend, into Monday, we will continue communication in terms of all the details surrounding e-learning. Our buildings, principals, administrators, classroom teachers for parents and your students, that information will be coming in many cases from that level. More broadly, we will be working to make sure that technology access is as readily available as we can. Specific information will be coming out on that. The child care will be available in some cases. We will have eye care at 3 locations in our building, but that, again, is a registration piece, and there will be a very fine capacity situation there. From a co- and extracurricular standpoint, this is always something that people ask about as you pay attention to what's happening with athletics. We will allow our co- and extracurricular activities to continue. However, we are very much dialing back on the amount of people who can attend those events. So we will be looking at 2 tickets for the participant, and we could say 2 tickets for parents, but that's too narrow of a statement, so 2 tickets per student or participant, and more specific details will come out so that everybody's very aware of how that works out. From a food service standpoint, we will be providing food again, a little bit different perhaps than it looked last spring when we had to roll this out. The school sites will be available between 11 o'clock a.m. and 1 o'clock p.m. each day. School buses will be on sites to distribute those curbside meals. They are free of charge to anyone under age of 18. I'm just reading off my notes very quickly in regards to that. We will get that detail in writing out to the community so people can look at that and see it. And in regards to that, as we look at the various things that there might be questions of, we will be shooting things out via our social media, posting information on our website so that parents can access that and see specifically what might be going on from a detail standpoint as we try to get from here to a few weeks down the road and hopefully back in session, back to normal from an in-person and remote standpoint. I think that is what I have at this point in time, and so we'll turn things back over to Dr. Nubalski to talk about the situation within the city and county a little bit more. Dr. Nubalski.
Thanks, Dr. Roberts. I think that it's been mentioned several times already about how people are probably getting a little tired about the reinforcement of wearing masks and proper social distancing, but I think now is the time, it's as important as ever, as important as when this pandemic first started, that we really need to be following these guidelines. I think we're all suffering from a little bit of pandemic fatigue. Everyone has heard that statement a lot lately, but I just really want to encourage everyone that this is a very important time for Bartholomew County. So, as it's been alluded to, many of our local cases have been linked to some of these public gatherings, whether it's weddings or baby showers or just family get-togethers. Due to this, we've decided that we've reached the moment in time that we need to take a more cautious approach as a community, and we're going to step back to stage 4.5 again here in Bartholomew County. These guidelines are going to be put in place for the next 4 weeks, and then we will reevaluate the numbers and see how activity of COVID-19 is in our county at that time. So I know that this is a very difficult decision to make. It wasn't made lightly, but it is one that we feel that is in the best interest for the health of our families and our community in general. I also want to take this time to encourage everyone to get tested if you have the slightest symptoms that seem suggestive of COVID-19, or if you've been in contact with anyone who has symptoms suggestive of the virus. We still have free testing available in Bartholomew County at the Fair Oaks location and also at the local health department.
Thank you, Dr. Nubalski. Mayor Liniff.
Thank you, Dr. Roberts. I'm Jim Liniff, Mayor of the City of Columbus. On behalf of the city, and I think I also speak for the County of Bartholomew, we want to add our support to the decision to return to stage 4.5. As Dr. Dombalski mentioned, it's a difficult decision, or it has been, but it's one that we feel is necessary for the public health. And while I'm sure all of us will sort of see that as a little bit of a step backwards, and I'm not one to want to take steps backwards, but it's one that's necessary at this point in time. We cannot ignore the math. We cannot ignore the information that we receive. We believe it to be accurate, and we believe that it points to continued spread of this disease that we need to try to mitigate as easily, as quickly as we can. As I said, we know this is going to be a difficult decision to implement. It will seem to fall upon others more difficultly, if that's a word. It will be a little more difficult for some to comply with than others, is what I guess I'm trying to get out. And we know particularly those organizations, those businesses that rely upon the public attendance will be adversely affected. And so, if we think about some of our restaurants or some of our other retailers, we want you to keep in mind that there are still contactless opportunities available for you to arrange for carryouts or deliveries or what have you, and we hope that you're able to access those methods. We've been asked already how we will enforce this move to stage 4.5, and we'll do it pretty much the same way we did it before. We're going to request compliance. We will ask people to be aware of the rules and to comply, and because they know what they need to do. And I will tell you that our previous experience with Section 4.5 was pretty favorable. I mean, we got what I would consider to be substantial compliance throughout the community, and I expect that we will achieve that again. But I want people to understand, just as important as it is to understand the rules, and I brought with me a copy from what was issued previously by the governor. Just as important as it is to follow the specific guidelines in the printed materials, it is just as important to follow the intent. It is important for us to understand, as we've mentioned before, that there are events that we can't necessarily anticipate, that we can't write down here, that we know you're going to have a baby shower, or we know you're going to have a wedding, or what have you, and there's going to be 62 people there, and is that okay? The point is that we want to limit gatherings. We want to limit the opportunity for the spread of this pathogen. It's airborne, so you need to restrict the amount of air that you share with other people. And so if you have to ask, if you have to inquire, well, the answer is probably no. You probably should not do the activity or participate in the activity that you're contemplating. We're welcome to field calls at City Hall if people have questions, but that I think would be as good a guideline as any. And we're particularly concerned as we head into the holidays, because we know as humans, we're social people, right? We're social animals. We want to get together. We want to see our friends. We want to see our family. But this is just a time where we need to be cautious about that. Excuse me. I hope that's just an allergy, but we'll, I think that's been my experience so far, particularly this time of year. So I just want all of us to remember that while we'll have some pretty guidelines with respect to stage 4.5, we want everybody to follow the intent. Remember, it's important, excuse me, it is important to mask up, hand wash, practice physical distancing, avoid crowds, just be smart about those as we go through the holidays. And remember, too, that these guidelines are necessary for our health, our public health, and by working together, we can keep each of us, individually and as a group, healthy. Thank you.
Thank you, Mayor Leniff. I think that concludes the number of speakers that we have for today. So at this point in time, Kelsey, I believe we'll open up to Q&A. And, okay. We might, and I know we have, again, a few of you online. I see John Clark now added there. John, good to see you. Let's start in the room here, and maybe just see first if we have any questions within the room, and then I can go back to the screen and see and monitor those that are on the screen at one time. So any questions from those present here in the room? Jenna? So it will, in the sense that our bus routes will not be running. Any bus service that we'll be providing over the next few weeks, we do have some classes that are, it's necessary to keep going. For example, C4 career and technical classes that require a certain amount of in-person instruction. And so those classes will continue. There'll be some limited bus service for students who are participating in those classes, as well as other students we might have in our building special needs students, ELL students, others that we will work to have in our buildings based upon need and to ensure we're providing services. So there'll be some limited bus service, but that would not accommodate the number or the need that the private schools might have. Dr. Bozeman, you're in a room, and does that answer that question appropriately? Thank you. Any other questions from inside the room? Okay, well, we have a few people online. Again, I mentioned John Clark, Barney Quick, Harrison Silcox, and Julie McClure. So if one of you want to unmute yourselves, I see John's hand go up because I see him on camera. John, I'll start with you.
If you can hear me okay.
We can hear you great. Thank you, John.
So my question would be, could someone go over in a nutshell, it seems like it's been forever ago since 4.5, tell us what this means, what we're allowed to do, what we're not allowed to do?
That's a great question, John. So I will ask who would be the best one to do that. Dr. Nabalski, and just step back up to the podium, Dr. Nabalski, so you have the microphone in front of you.
So in regards to stage 4.5, the main changes are a lot of indoor activities. So dining room food service will still be open, but will be reduced to 75% capacity. Bar seating and in-person capacity will be limited to 50%. Other things that will likely affect Bartholomew County will be movie theaters and bowling alleys will be moved to 50% capacity, or any other indoor entertainment activities. And then social gathering size will be limited back down. Currently it's at 500, it will change to 250. Before, we would allow organizations to submit plans if they're planning on having more than that maximum stated number, but for the time being, we're putting a hard cap at 250.
Okay. Thank you, Dr. Nabalski. John, any follow-up question to that? Well, Dr. Nabalski's still at the podium.
While Dr. Nabalski is standing there, can we talk a little bit about the number of deaths and where we're seeing those deaths? I had heard they were almost all nursing home deaths, but I wanted to get some clarification on that.
Yeah, so we're still seeing a large majority of deaths are occurring at age 60 and over, and still a large number of those are nursing home deaths. That is correct. We're luckily here in Bartholomew County, we're seeing a very low number of deaths here over the last several weeks, but that statewide trend is increasing. So it only stands to reason that we may be seeing that here locally. We still have a nursing home here in Bartholomew County that's dedicated to care of COVID-19 positive patients. So anytime those patients become ill enough to require hospital care, they're going to be coming to Columbus Regional.
All right, I'm getting the thumbs up from John. Thanks, John. Any other questions? Maybe I'll just go down the order here to make it easy for each of you. Barney, do you have any questions for us? Okay. If you are saying something, Barney, you would need to unmute. If not, I'm going to move on to Harrison. Any questions from you, Harrison? Okay, Barney, I'm seeing you pop back on the camera. Any questions that you had, Barney? Okay, go ahead and unmute yourself, Barney.
Unmute, here we go, okay.
There we go, yes.
All right. Your statistics about red, I'd like you to go back over those if you could, please.
Yeah, so
the three categories in which we are classified as red.
Yeah.
And, yeah, you could please.
Yeah, sure will. And so for everybody's sake, again, always a little bit lagging data. And so what today's numbers might look like, it could change everything that I say. The information posted yesterday by 5 o'clock on our Community COVID-19 Task Force site would actually represent numbers from Wednesday. So the numbers I'm giving are from Wednesday. It would be November the 4th. And the per capita rate was at 33.4. And that has went up dramatically over the last week. 15 is when we look at and say it's red, 15, and we're at 33.4.
Okay.
In terms of the hospitalizations, we look at hospitalizations at 15 is red, and we have been yellow for quite a number of days, but just tickled the red number by getting up over 15, and I think we're maybe still at 15, but again, that number changes. It could change by 2 today and be back down into yellow, but it is red, or at least was in the publication yesterday. And then the third number I gave shows up as yellow on the sheet, but it was 13.2, and 15 is what we're saying is red. And that is always a lagging indicator, because as we try to track that data internally, we are 4 days behind typically with having the most accurate data. So that date there is even earlier than November the 4th. It was at 13.2 and trending toward 15, which would put us in the red. So what I'm indicating what's likely with 3 reds is because, again, that is old data, and today the percent positive rate to have a 33.4 per capita rate is likely to be in the red.
Okay. Thank you.
You're welcome. We're going to bounce back to you, Harrison. Anything to ask of us? Julie, you're also on the call. Anything, Julie, from you?
Can you hear me?
I can. We can.
Okay, thank you. I have a question from Andy East. When does 4.5 officially start? Is it right now, or is it on Monday? And my second question is, I'm seeing a lot of people in the Columbus community not wearing masks throughout the community, whether outside or inside, since stage 5 began. Is there going to be any kind of mask enforcement to perhaps encourage these people to wear masks?
Dr. Nabalski, Mayor, who wishes to respond to that combined question there? All right, Dr. Nabalski is stepping to the podium. Julie.
Thank you.
You're welcome.
So my intent was to start the 4.5 as soon as we can, whether that is if we can get that out later today or start it tomorrow. What was the other question?
It wasn't.
My other question was
about the masks.
Masks,
Yes.
and whether there'll be enforcement beyond just the encouragement and asking people to comply. There seems to be in stage 5 kind of a general blasé attitude about masks throughout the Columbus community.
Right. As of right now, we're still not going to be fining individuals for mask wearing. We've definitely been having those discussions, but we're choosing to still implore individuals to do the right thing and wear their mask when they're out in an appropriate area where they feel that they cannot have proper social distancing.
Thanks. And one last question for Dr. Nabalski. Do you have concerns about employers and employees, the number of people who have returned to work and what is happening in our manufacturing facilities and even in our retail businesses? Is there any concern from the health department about community spread there?
Well, I can only hope that, a lot of the larger companies, they have their own kind of guidelines in place, and I would hope that they're at least following CDC guidelines, or I know that there are several that are a little bit more strict than that. So I haven't heard any complaints at my level of people being lax in that effort, but if there's any of those types of questions that should arise, I'd love to have those be directed to the health department.
And is there any effort by the health department to kind of monitor air quality in any of these facilities, since it is an airborne disease? Is that a concern, or is there any way that can be checked about air quality and air circulation in these buildings?
Yeah, as of right now, I'm not aware of any efforts like that going on locally.
I had one last question for Dr. Roberts on extracurriculars and things like that. I understand the East open house for its auditorium has been postponed from Monday. Does that also mean they're having a show this weekend? Are things like that going to be allowed to go on as with athletics, but
They are, Julie. So we probably should have couched that more generically in terms of co and extracurriculars, so not just athletics, if that's how I stated it. So any co or extracurricular event that involves our kids, we are going to allow them to participate in that with limitations, again, on who else can be in there. So there will be additional limits put on capacity and whatnot in terms of those attending that, but the show shall go on.
Okay, thank you.
You're welcome. I would add, Julie, just based on the question of Dr. Nabalski on the piece with positive test cases and close contacts, as I went through the mitigation strategies earlier, both from the school standpoint and asking the community to practice those as well as they can, is also adhering to those guidelines at a bare minimum, is that the CDC and ISDH, Indiana State Department of Health, have laid out pretty clearly the expectations of a positive test case and being home, isolated, and also for quarantining if you're a close contact, and there continues to be questions about can I come back, can I come back, can I come back, and I'm sure that then that occurs, but unfortunately, people might feel just fine and want to come back or go out in the community and participate in things, but it runs the risk of continuing to spread virus. So I would ask that to the degree possible that people continue to abide by that isolation if a positive test case and quarantine if a close contact to the degree expressed by the CDC and ISDH.
And I had one last thing, and I don't know if it's possible for you to answer this or not, but how can the community help BCSC right now as far as students who might need food, or students who might need transportation, or pods of places where they can get internet? Is there any way the community can help BCSC right now?
Great question, Julie. Thanks for asking that. And I think at least at this moment we are good. Some of that will get sorted out, and we'll make additional requests. But from a food standpoint, just based on how things are set up, we should have the food necessary to provide meals for our kids each day. We may need help, with additional sites or making it more convenient or something like that as we start the process. We'll see. From a transportation standpoint, the students will be looking to bring in for the specific reasons. Career and technical education, as an example, we are working on that routing. I think that we'll be able to address that at this point in time. Special needs students, others that might need to be in our buildings. I think the technology access might be the one that we always wrestle with. So the more places that are available for our kids to go to that will raise their hand and say, hey, we're okay with students popping in and using our internet, the better. This is a little different circumstance than in the spring. In the spring, when we shut down, everybody shut down, so some of the places we would maybe rely on in the past weren't open either, and so kids couldn't go to those. That's a little bit different now, and some of those open places they can get to, so we would just ask for that assistance. But for any additional specific requests from us, we will get that out as soon as we can.
Thank you.
Okay, you're welcome. John, your hand is up. Go ahead.
So I may have missed this earlier. I know Dr. Nabalski talked about some of the, for lack of a better word, super spreader events. Had been some functions like weddings or get-togethers or what have you. Are any of those traced back to the schools? Is there any indication that kids going to school are bringing COVID-19 home from a school setting or from a school event? Like I know there was a sectional game earlier in the year that apparently caused a lot of cases. Not here, not
Sure.
in Bartholomew.
Thanks for that question, John. I'm aware of that one, and I think that was an Indianapolis-based sectional, and there was even some concern about maybe a sectional even closer to us having some cases related to that where large people were in a gymnasium, a lot of people were gathered. We are not aware, and I'm looking to Dr. Nabalski and Dr. Sonderman to correct me if there's something they're aware of that we haven't talked about necessarily, and Kelly Thompson, our Director of Health Services, in the room too, but we are not aware of that situation where we have a person who has a positive test case and then spreading that. So at least in the school setting of a person with a positive test case, we identify close contacts, and then those close contacts also testing positive after. And I'm not about to say that that hasn't happened, or that there's some asymptomatic situation, or the person who is positive didn't get it from somebody else that was maybe asymptomatic. But we have definitely not seen any super spreader situation where a person has been at something and then that's resulted in multiple spread. And I commend our going back to the extracurricular pieces, we've been able to maintain that well. Comparatively, there are many teams that, because of positive test cases, close contacts, or otherwise throughout the state, who've had to forfeit games, missed the football sectional tournament, whatever those things are, and our coaches have done an outstanding job with that, of managing that to allow us to continue to participate and then really not miss anything throughout the fall. Any other questions? As I'm looking at the screen here, Jenna, I might just jump back to you in case there's anything as you've listened in, if there was something else that you might have. Okay, thanks, Jenna. And always feel free to reach back out to us, of course. Okay, anybody else with questions before we then wrap up today's press conference? I was always taught to give at least 8 seconds of wait time, and I think we're there. So we will close today's press conference. Thank you, Mayor Lenup, Dr. Sonderman, Dr. Nabalski, Kelsey, for helping arrange this, from CRH, others that have been involved. Again, I want to thank the community for their efforts thus far for us to get to where we are today. We're very proud of the fact that we've had 60 days of in-person instruction, so it hurts me. I know it hurts the community for us not to be in school over the next 3 weeks, but I hope that are the changes that we're making, that we can help get things steered back in the right direction and bring the cases back down to a manageable level, because we know it's not going away, but how can we manage this so we can be as normal as we possibly can be? And we appreciate everybody's assistance in that. Thank you for tuning in today.